Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment, I'm starting something new on high cholesterol. High cholesterol is a very common problem, and that's the generic term for abnormal lipids. What people has to understand, however, uh, I would say roughly 39% of adults across the world have high cholesterol. And in this country, 106 million folks and thereabout have high cholesterol. 50 million 800,000 males have high cholesterol. 55 million 900,000 females have high cholesterol. 47.9% white males have high cholesterol. 49.7% white females have high cholesterol. 44.8% black males have high cholesterol. 42.1% black females have high cholesterol. And altogether, 17 million children, adolescents, have high cholesterol. Very common problem. Let's take a look at what's happening in Europe. 54%, as I stated, of both sexes in Europe have high cholesterol. In America, 48% of both sexes have high cholesterol. In Africa, 22.6% have high cholesterol. In Asia, 29% have high cholesterol according to WHO. Now, when people hear high cholesterol in the public, that's a generic term, what we really do as physicians is really a lipid profile, because there are several parts to the cholesterol that we order. Okay, so let me give you an idea of what I'm talking about. You have what's called hyperlipidemia. You have high cholesterol, high triglycerides / high cholesterol, high low density cholesterol, LDL, low high density cholesterol, HDL, high cholesterol / LDL ratio, and high VLDL cholesterol. That's what's involved in a complete lipid profile. So when we order a lipid profile on someone routinely, what we're going to get back, we're going to get a total cholesterol, we're going to get the LDL cholesterol, we're going to have the HDL cholesterol, we're going to get the triglycerides, then we're going to have the ratio of the high cholesterol / LDL cholesterol. What has to be understood that each one of these things represent a risk factor for plaque formation in vessels. Each one of them individually. So when you are talking about lipid profile, when I get to talk to you about it, you will understand what lipid profile really means. Suffice it to say that each one of these things individually has a problem, is a risk factor for coronary occlusive disease or other occlusive disease of vessel, etc. So this has to be understood so that you can understand exactly what it is that physicians do and what we are talking about. Now, also, I want to, in this segment, as I do it, and it's going to take several weeks, you're going to find out that cholesterol is not always that bad. We need cholesterol. We would not be a functioning human being without cholesterol. And I'll explain that. But before I get to that, I want to explain to you that what in fact is going on in the genetic of elevated cholesterol. What is in fact going on? It is a genetic phenomena that parents transmit the gene for elevated cholesterol to their offspring. And there is a substance in the blood which is really crucial. That particular gene is carried on the long arm of chromosome number 5. That's the abnormality that gets transmitted either from one parent to children or both parents to children. But the important thing is that you have to understand there is a substance called hydroxymethyl-glutaryl-CoA reductase. It's long. Let me repeat it. Hydroxymethyl-glutaryl-CoA reductase. From here forward, I'm going to call it coenzyme A because I don't want to have to repeat this long word again and again. So as I'm doing the show, I'm going to refer to it as coenzyme A. Why is that important? Well, the coenzyme A, here's the deal. In order for you to have elevated cholesterol, the mechanism is the overactivation of the coenzyme A that causes an individual to overabsorb cholesterol. By overabsorbing it, the bloodstream is loaded with the cholesterol, and some of it get deposited within blood vessels of different caliber, and the rest is get taken into the liver, get mixed up with the bowel, and then put out in the stool. That's why when one has a bowel movement, that is why one of the reasons why the feces look what it looks, brownish type color. That's where that comes from. It's the bowel. If one were to have a blockage of bowel, which happens very frequently in common duct disease, the stool will look whitish, which is an abnormality. So let me repeat that. The coenzyme A is the overactivation of the coenzyme A that causes an individual to overabsorb cholesterol that then results in overabsorption of the cholesterol, causing the elevated cholesterol. All the medications that are out there, all the statin, are used in one way and one way only, to block the overactivation of the coenzyme A, thereby preventing the overabsorption of the cholesterol. Okay, this is very important stuff. You probably never heard this before. You didn't even know how, I'm sure, this works. The abnormality, the gene that you inherit from your parent, is located in the long arm of chromosome number 5. And what that does, that then causes the overactivation of the coenzyme A. So when we are treating someone with medication, it is the coenzyme, we are blocking the overactivation of the coenzyme A, preventing it from allowing us to overabsorb cholesterol. That's where the treatment comes in. Okay, now, I mentioned earlier, I'm going to be here for a long time doing this series, so we got plenty of time to talk about the bread and butter of hyperlipidemia/high cholesterol. But I want you to understand something. We cannot be functioning human being without cholesterol. Cholesterol is extremely, extremely important. Why is that? Well, there cannot be no formation of any hormone, no creation of any hormones in the human body without cholesterol. That's exactly correct. The very first ring when the chemists or the / biochemists are going on the blackboard to write out a particular hormone is the cholesterol ring. That's right. So the more cholesterol you have in your body, the more a particular hormone, whatever that hormones happen to be, you are producing. Now, let's take a look at the meaning of this. I said to you that all hormone, if somebody suffers from anorexia nervosa, if it's a female, she's likely is not going to be able to menstruate, assuming she's of the menstruation age. Why? Because she cannot produce enough estrogen and other hormone that is needed for a woman to menstruate. If it's a man, he cannot function as a man in a real sense, is because the male hormone organs will not be functioning properly if he's not able to produce androgen slash testosterone. You cannot. Where is the uh, hormone coming from? Where is the cholesterol coming from for you to create the hormone? How about that? Because most of it is coming from the food that you eat. It's coming from the food that you eat. So the more cholesterol you ingest in your diet, the higher your level of cholesterol is going to be if you happen to have this abnormal gene that you inherited either from one parent that makes you heterozygote or from two parents that makes you homozygote. I'm talking about cholesterol itself, okay? Cholesterol itself. You cannot survive properly in your mother's womb if she's not able to produce certain hormones such as estrogen. Then you can't. The fetus will not survive without the proper amount of all the female hormones that is needed to maintain the pregnancy. And on top of that, you need the growth hormone for the fetus to grow. On top of that, you need the thyroid hormone in order for the fetus brain to develop properly. The fetus brain will not develop properly without thyroid hormone. But where is the thyroid hormones coming from if the mother doesn't have enough thyroid hormone in her bloodstream? Well, she needs cholesterol for that to happen. And if your mother were to be hypothyroid while she's pregnant, then you're likely going to produce an infant that has underdeveloped brain, a condition called cretinism. Again, as I continue with the series, I will show you all the good things that cholesterol can do, all the bad things low cholesterol can do, and all the bad things high cholesterol can do, and all the good things normal level of cholesterol can. This is new concept. I'll be sitting here detailing this to you if as though I'm sitting in a class teaching this stuff. So when you hear high cholesterol, you have to understand what they're talking about. We have the high cholesterol, then you have the lipid profile, okay? And the lipid profile has completely different concept associated with it. Let me go here. This is a chapter from this big blue book that I wrote, The Art and Practice of Modern Clinical Medicine in 2016. I copied that last night and bring it here with me so that I can discuss this with you so that you understand the concept of lipid profile as opposed to just cholesterol. So we have type 1 hyperproteinemia, okay? Then that's manifested at high chylomicron. Then you have type 2A, cholesterol. You have type 2B. When you have type 2 is type 2A, type 2 is cholesterol by itself. When you have type 2A is cholesterol plus a little bit of elevated triglyceride. Then you have type 3 hyperlipidemia, which is elevated triglyceride by itself. Then you have type 4, which is both high cholesterol and high triglyceride. Okay, it's amazing how interesting and complicated these things really are. So I just mentioned the word triglyceride. Well, triglyceride is another abnormality in the lipid profile, which is separate from the cholesterol issue. And triglyceride itself is a risk factor to you to develop occlusion of your vessel, etc. So It is incredible how fascinating and interesting these things really are. Okay, so you have to, so when we do a lipid profile, we are doing all this stuff. We do the type 2B, as I said, hypercholesterolemia. If it is type with a little bit of elevated triglyceride, type 3 is hyperlipidemia, isn't triglyceride is super high, and then we have uh, type type 4 hyperlipidemia is when you have a high uh, 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 triglyceride and very high uh, 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 hyperlipidemia, as I just mentioned. So you have to understand these things. So when we do these things, the generic term that is used out there is high cholesterol. Yes, but you have to understand when we do that, we are looking for it at the cholesterol, the total cholesterol. We're looking at the LDL cholesterol. We're looking at the HDL cholesterol. We're looking at the ratio of the high cholesterol slash LDL, then I mean HDL slash high cholesterol. Then we'll of course looking at the whole concept of the high cholesterol by itself. So this is crucial that you understand all that stuff, and it is very important because each the managements are different. When we get to talk about treatment, you will understand we treat elevated total cholesterol separately, differently than we treat high triglyceride. Then, when we talk about HDL, if your HDL is high density lipoprotein is high, it protects you. That's right, it protects you from the elevated total cholesterol. However, you could have normal total cholesterol and a low HDL, you're still at risk because the HDL is very important in the protection of the body from the effect of cholesterol itself. Those are crucial things that has to be understood. So as the series goes on, you will see and learn a whole lot of this stuff, how we go about evaluating all these things. Let's talk a little bit about diet. What happens? Well, we have a situation whereby 1 out of every 8 individual in this country live in poverty in one form or another. And across the world, you have 7.7 billion people as of 2018, and more than half of them live in poverty, and a quarter of the world population are basically starving. And yet, the top 2% control 98% of the wealth. Okay? And then the poorer you are, you're forced to eat a lot of junk food, which is loaded with simple carbohydrate. It's loaded with fat, loaded with salt, and this is very bad for you because that's the story. I grew up poor in Haiti. I was living in the peasantry, but the stuff that, because I was so poor, the stuff that I have access to were fruits. Little did I know, as poor as I was, as hungry as I was, I have access to guava, have access to mango, have access to suel, I have access to papaya, I had access to sugar cane, because those things were free. Literally, you didn't even have to buy them. You just go to the tree and get them. So you could eat to your belly's content. And that's what's happening in the developing world as well. So, but in the developed world, when you're poor, when I just came to this country here, making $1 an hour in factory, my food was basically American cheese Wonder Bread, and a cup of Kool-Aid. That was it. And then and before I go to school in the evening, I used to bring a thermos with me. The thermos had little fine spaghettis that you buy, the cheap one, with chicken back. I would put some salt and pepper, boil that, and stick that in the thermos and put it in my valise. And before I clean up my clothes to go to school at night, find myself a little corner and eat that stuff. That was it. But nowadays, poverty is even worse now, frankly, than it was in the 60s. Because in the 60s, as bad as things were, uh, it was cheaper. Someone asked me earlier today, how about New Year's Eve? I said, I recall going to 42nd Street, and there was a spaghetti place where you could eat all the spaghetti you want. I believe it was 45 cents, 50 cents, or a dollar, whatever it was, and that was it. And then you could go and pay $1 to the movie house and get in. Once you get in, you could stay there the whole night and get home at around 4 o'clock, 5 o'clock in the morning, back in the subway, back home. That was my New Year's Eve. But nowadays, you can't do that anymore. Everything is so expensive. And then you have a lot of, and I'm not here to badmouth anybody who sells these things. No, I'm here to name any particular food because I don't want to put a negative spin on anybody's food. It's a free enterprise system. People have the right to sell the product. But what choice did these folk have? They don't have enough money to pay their rent. They don't have enough money to buy clothes, and they have to eat. I don't know if anybody understands what it is to feel the pain of hunger. To this day, I wind up sleeping in certain ways because that's the way I had to sleep to press down, to crush the pain that I experienced when I was growing up after the passing of my mother. Because I've been on this world since I was 7 years old. So I'm not comparing my situation because, as I said, when I did get a chance to eat some stuff, I was eating healthy stuff. But there's no healthy stuff. An article just came out last week on the JAMA website naming the different states, the disparity that exists in elevated blood pressure because of the diet that black folks are forced to eat compared to other folks in this country. This stuff is lethal. So poverty, though it's not a shame to be poor, but it costs you your life. The lifespan decreases significantly the poorer you are in the developed world because you don't have anybody to whose house you can go and get a piece of food. You have to wind up buying the junk that's being sold in the community. So diet is a major problem. And obesity is highly associated with high cholesterol. Of all the developed countries in the world, the U.S. have more obese people than any other country. 49 point something of all adults in this country are obese. Some 13 to close to 19% of children and adolescents are obese because of all this junk food that people have access to. And of course, when you're obese, you wind up having syndrome X, which is a combination of obesity, high abnormal lipid, diabetes, and what have you. So this is a serious thing. So we think about cholesterol when it is elevated, all the heart attack that it can cause, the stroke that it can cause, the eye problem that it can cause, the kidney problem that it can cause. That is true, no question about it. And I'll be getting into the detail of how these things occur. But also, we can't survive without cholesterol. We need cholesterol to remain healthy. The entire field of endocrinology wouldn't exist without cholesterol because you can't have any hormone of any types without the first ring being cholesterol ring, and then you attach different things to it to make the different hormone that you're making artificially or what have you, and that the same thing happens in the body. Okay, so we talk so much about high cholesterol, if as though cholesterol is a poisonous thing. It's not. It's bad when it is elevated, We try to decrease it medically, but we need it in order to remain healthy as well. And there are many, many conditions that I'll be talking about that can cause somebody to have low cholesterol. So when you see somebody with low cholesterol, it raises a red flag. Does the person have Crohn's disease? Does the person have a whole lot of other disease that causing malabsorption? So when you see low cholesterol, right away, as a clinician, you're supposed to investigate to find why. Why is the cholesterol low? Then you start an evaluation because you have Crohn's disease, which is a segmental disease that can affect different part of the GI tract. It may be affecting the part where food absorption takes place in the small bowel. So is that affected? Then you could have low cholesterol that way. If the person is anorexic, we see on television all these folks that are starving, skin and bone, all over Africa. How can they grow normally? They can't grow normally because they don't have enough food so that they can produce enough hormone for them to grow properly. So their growth will be stunted. This young girl won't be able to menstruate because they're not making enough estrogen because they don't have enough cholesterol intake to produce the estrogenic hormone and other female hormone to menstruate. The young man cannot develop properly either, and so on. The reverse, of course, is true. When you have too much cholesterol, then you are at risk of developing many, many diseases besides the occlusive disease of the vessel. There are a lot of other diseases that can occur because your cholesterol is high. Classic example, uterine cancer, prostate cancer, cancer of the pancreas. All these things can happen because you have too much cholesterol. You're producing too much hormone that's stimulating the lining of the uterus. You have too much hormone that over producing androgen, over stimulating the prostate gland. You have on and on. So it's a balance that you need to have. And as I carry on with the series, I'll be explaining to you how you create this proper balance, if that's possible. Because if you have anorexia because of your poverty situation, living in a developing world, you're starving, what you need is food. There's nothing else that will do but food, okay, to try to produce the necessary hormones so you could grow properly. Listen, I'm going to stop here, and until I see you again, this is Dr. Alcena saying so long and bye-bye.